This is just to give you guys an example of the kind of kit that we're wearing on the front line now. So I'm just trying to show you what we're really using to keep safe and protect ourselves. So we're taking all the measures that we need. So it's 10:30 in the morning now. I'm just heading into A&E for a 9-hour shift. I'm expecting things to be really, really busy. Actually, we now are being told to stay at home very, very clearly, and there will be, penalties imposed if people don't follow that. I think actually it's so important. We're seeing the number of cases rising in the department and departments around the country as well. And the number of cases of those people being unwell is rising. The ITU beds are being taken up, ventilators are being taken up, and this is clearly is a really serious crisis. So I am expecting today, as I go into the department, to see majors and resus, the areas where patients are the sickest, to be really, really busy. I know there's a lot of pressure on the hospital at the moment in terms of beds. We're hoping that the staff also will stay well and not catch coronavirus, because at the end of the day we need our staff to be well, fit and healthy. It's going to be a challenge over the next few weeks, and I think we're all going to have to pull together and work extremely hard and be unified as a nation in this. So the department is actually really, really busy. I've been here for a couple of hours now, and we have many patients, both in majors and in resus, who are positive for COVID-19. The intensive care capacity has been taken up in the hospital. NHS staff, everyone here is in really positive mood. Everyone's working hard, doing their very best. But obviously we're seeing more and more patients. Just to give you an idea here of, we have our PPE equipment that we're wearing, with the gloves and also our masks as well. So just to give you kind of an idea, obviously I've washed my hands and everything or touching everything. So yeah, we've got what we need here, but it's really important we do have the supply that we need, a continued supply, and that we don't end up running out. So that's so vital on the front line. Yeah, so I'll keep you guys updated.
Hello everyone, welcome back to my YouTube channel, welcome back to another video. In this video I'm going to be talking about what it's really like to be on the front line in A&E, seeing patients with confirmed cases of coronavirus. I'm going to have a really frank conversation with you guys, explain exactly what I've seen from my own experience as an A&E doctor in London. I'm also going to talk about my thoughts on what I think is going to happen, how the weeks are going to unfold, and also some tips and advice for you guys at home to stay safe. You might have just seen a little clip of myself on the way to A&E just the other day, and yeah, essentially like going into work at the moment is quite apprehensive. You're never really sure what you're going to see. One of the beauties of A&E actually is that when you go in each day, you're never really sure what you can be faced with. It's part of, I guess, the package of being an A&E doctor. But in these times, it's a bit more than that, because of course we are uncertain at how many cases of coronavirus we're going to see. We know that every day, there's hundreds, if not thousands of new cases around Europe. In London, we are seeing a huge amount of pressure now on the departments. I remember just a few weeks ago when we were out in the pods, many of you remember my video I did a little while ago talking about what we did in terms of how we decided which patients we'd see, which ones we'd test, and the process of that. Things have changed so much now. And the A&E feels completely different. And to give you guys a little idea about how we've structured the A&E departments, because it's changed quite drastically in order to separate patients, the coronavirus cases from those who are in A&E for other reasons, because that's the other point. Patients still have to come to A&E. Those who are unwell, who are having heart attacks, accidents, other illnesses, still need our help. So we have to work out how to balance it all. The normal setup in A&E is you have a minors department or an urgent care department, which you see kind of the cuts, bruises, minor illnesses that can be dealt with in that department and hopefully sent home afterwards. You then have a majors department. In the majors department, patients are sicker, they're more unwell, they might have more underlying illness, and those are the patients we're thinking we might have to admit. Resus is for the patients that are the most sick, the most unwell, the ones we're really worried about, the ones we're worried about whether they're going to survive without our help and input. So that's how a normal A&E department is kind of structured. Some changes depending where you are. What we've done now is to have a big overhaul, a big change. So we don't want to mix patients with suspected coronavirus with those who are in the hospital for other reasons, who have no symptoms or reasons that we can believe or think that they have coronavirus. So what we've done is we have a resus department, which is a part of the department we are now putting patients with suspected coronavirus in, because We know that a certain number of them require intubation, so having tubes passed, put into a coma and taken to intensive care. We know that that area is suitable and a good place to deal with those kind of patients. We're having another area, another resus part of the department, which is kind of a clean resus. That's not to imply that people are dirty that have coronavirus, but the idea being that that area is kept and reserved solely for patients without any symptoms of coronavirus, thereby reducing the risk of transferring it from those with coronavirus to those who have come in for different reasons. The same has been done for majors. We've got 2 different majors departments. We keep them entirely separated, and the minors is for non-coronavirus symptoms at all. The next question, I guess, is how do you staff that kind of situation? So what we've had to do is separate doctors and nurses between those parts of the department and restrict access. So if you're in the clean majors department for the day, you are not going in any circumstance into the other side with patients with coronavirus, and that hopefully reduces the risk of transferring the virus from one part of the department to the other. So it has been a huge logistical challenge, a bit of a headache for those in management and senior consultants, but they have acted very quickly to make that happen. So that's kind of an idea of what the department looks like. Now, I know a lot of you want to know, what is it really like seeing patients with coronavirus, and those are particularly unwell, and also touching upon what kind of patients they are, what demographic of patients I guess they are. So what we know is that 90%, 95% of those people who catch coronavirus will make a very good recovery and won't require any of our input at all. So about 10% of patients are requiring our input. Now, the symptoms that people are having when they come in, they can be very subtle actually, and we're learning more and more about this. Of course, we're in a period of lockdown in the UK now, or near enough to lockdown as you can imagine. And so we have been telling patients if they have the high temperature and the persistent cough or the persistent cough, then those are the symptoms we're really looking for coronavirus. But there are some other symptoms that can be subtle. This is what we're seeing as an emerging pattern, if you like. Again, this is new, it changes day by day, and it will take months, if not years, to look back and say, definitely this was a symptom and this wasn't. But some patients that have come in that I have seen and have been diagnosed with coronavirus have said they've had simple things like loss of taste, loss of smell, a sore throat, gastrointestinal upsets, sometimes just diarrhea and feeling a bit nauseated, and also then followed by the cough and the fever. So it's interesting to see that there's sometimes other symptoms that can, give us an idea that this is coronavirus. Particularly, I think young people might have very, very subtle symptoms. In fact, 20 to 30% of patients, particularly it seems young people, might not have any symptoms at all, which is why we worry about people congregating in groups or not following social distancing, as you might not know that you have it and you might not know you're giving it to someone else. So yeah, people can have very subtle symptoms. For those that are really unwell that come into the department, the common factor is the persistent cough, extreme shortness of breath. I'd like to reiterate that most people that have the cough and the fever will recover well at home, but some of those are requiring our help. Let's talk a little bit about what kind of patients I've seen in hospital. So the other day I was in resus, so the part of the department which is where the patients are most unwell, seeing patients with coronavirus. Now, what we're seeing is quite a mixture of demographics. A common theme is that patients we're seeing have an underlying illness, so that's whether it's persistent high blood pressure, whether it's diabetes, whether it's respiratory problems like asthma or immune problems, and also elderly. So we have seen quite a few of those patients requiring our help. A percentage of those require intubation. So those are certainly a proportion of the patients that we're seeing in the department, but I have seen some young people. I saw a patient in the 40s the other day who was otherwise fit and well, no other health problems, didn't smoke, exercised well, didn't have a high BMI, and was very unwell with coronavirus. I don't want to scare people. This channel is not about scaring people, but I do want to be honest with you. It's very unlikely that someone that's young, fit and well will become very unwell with coronavirus, but it's not a guarantee. What I want to tell you is it's not a guarantee, and that's why it's so important to follow the social distancing, to wash your hands and be careful. Again, it's about being alert, not anxious. If you follow all the steps that you can, you stick to the hand washing, you follow the distancing and isolation rules, then that is your best opportunity to stay safe. So what happened to the patients that I saw? Of course, I need to be very respectful and careful about patient confidentiality. We are, of course, seeing some patients, in rare cases, passing away because of coronavirus. Most of the patients we're seeing require a little bit of our input. They might need to be admitted to a medical ward and monitored for a few days and then discharged from there. So they're doing quite well, might needing a little bit of oxygen therapy. They might need a bit of fluid therapy and analgesia, but they're doing quite well. A small proportion of patients are requiring intubation. So why do patients with the coronavirus need to be intubated? So what we're seeing is that because the illness affects the lungs, as well as other body systems, it affects the lungs, and this causes a problem with breathing. And when they have breathing problems, some of these patients can end up having very, very low levels of oxygen in the blood. They're hypoxic. So when we measure their oxygen saturations, they're very low. Now, for some of those patients, when we give the oxygen mask, that picks up fine and the oxygen level comes up, we keep them in, we oxygenate them well, we monitor them well for several days. However, there is a percentage of patients that we're seeing and we're giving oxygen that isn't enough, that they're not maintaining good levels of oxygen, and that despite our health that they're becoming more unwell. And for those patients, they require, on occasions, intubation. So this is being induced into a coma, a tube passed down the throat, and we breathe for them with ventilators. And what will happen is they will go on an intensive care bed, an intensive care ward, and be monitored for several days, be cared for by specialists to get them over that period of illness. The vast majority of patients that's happening to are then making a good recovery. The vast majority of the population who catch coronavirus will have mild to moderate symptoms and recover very well with it without us ever seeing them or being involved in their care. It's a small percentage that come in very, very well, but I just want to be honest with you and say to you, yes, most of them are elderly or have underlying illnesses, but we are seeing young people, even in their 20s, being very unwell. So please bear in mind, it's not a given, and do everything you can to support us. We are the NHS, we're working hard on the front line, and we need your help. We need to have as little patients as we can in the department at any one time so that we can cope with that. We have a lot of patients very sick with coronavirus at once. That is what puts us under a lot of pressure. So it's really, really important that we need your help. Now, finally, I want to touch upon personal protective equipment, because that's something I know there's been a lot in the media, there's a lot of talk around it. Have we got enough on the front line? Well, let's talk about that now. So here's a little clip of myself in A&E the other day with the protective equipment on.
This is just to give you guys an example of the kind of kit that we're wearing on the front line now. So I'm just trying to show you what we're really using to keep safe and protect ourselves. So we're taking all the measures we need to. We're asking people at home to follow the same measures and stay safe, and stay at home so we don't pass on and continue the spread of the virus.
So you can see there that I'm wearing the face mask. Those are fitted masks. We test those on each individual to make sure it fits correctly. I'm wearing the goggles. We also have visors if necessary, and we're wearing full gown, double glove to protect us. Of course, we're taking hand washing and other cleaning procedures very seriously also. On the front line at the moment, in my experience, we have enough of this protective equipment, but we do need to make sure that the supplies remain. So I hope the government really prioritise that and keep us safe, because at the end of the day, we're on the front line and we need to stay safe. So I'm going to show you a quick clip of me now at the end of my shift, reflecting on what had happened. As you can see, I was looking quite tired. It had been a fairly busy shift.
So it's come to the end of a very busy shift. Obviously we've seen a lot of patients today. We are seeing an increasing number of patients with coronavirus in the department, and as everywhere is up and down the country. So it's really important that everyone is doing their bit. They're washing their hands, they're staying at home and following the government advice. The NHS is working so hard to do their best around the country, and we will get through this.
So yeah, just to reiterate, it's so important that we get the support from you guys at home. Please stay at home, please support us. Thank you to everyone who's working so hard in the front line, all the key workers, the NHS staff that are doing their bit. I hope that's given you a little idea about what it's like on the front line. We're seeing a growing number of patients coming in, 10, 15, 20 a day who are requiring our help, and some of those are needing intubation. This is the reality of the situation. We can get through this. There's going to be a lot more on this channel about this topic. I'm going to be talking about testing kits when they're coming and what they're going to be like, when you're going to have access to them in the community. I'm going to answer more of your questions in the Q&A. So please do comment below questions you want to ask. So put your questions below and I will be looking at those and picking questions to answer in the next Q&A. Thank you everyone for watching this video. Please stay safe, wash your hands, take care and goodbye.